Cool, thanks, Todd. So I'm Dennis. So I'm wrapping up with the last case. So we're here to, my case is an 18-year-old gentleman who you see in the emergency department overnight on a night shift on Friday. He comes in after being assaulted. Someone knocked him over the head, was in the process of beating him up. Luckily, some bystanders came by and rescued him. For him, he did not have loss of consciousness. He does have some superficial abrasions, but luckily no real trauma beyond that. However, in digging deeper, you find out from him that this is the second time he's been assaulted walking home late at night. He works a swing shift, he works weekends, and often he gets off pretty late. He feels like he doesn't have much of a choice in negotiating with his employer. He feels lucky to have a job. You asked him if he wants to make a police report because it seems like the same people are coming after him. But he seems a little hesitant. He reveals to you after he used an interpreter that he's undocumented. He's afraid the police will report him to ICE. He's had a few friends who've been deported recently. Then you ask him, at the very least, if you can get him a work note to give him a couple days off. But he tells you that as much as he would like a day off, he can't really afford to do so because he's paid in cash. He lives literally day by day, and if he takes a day off, he might not be able to make rent. So I think this case summarizes a lot of the things that have been brought up in terms of immigration status, especially individuals who are undocumented. Even though there are many protections in place for our patients who are undocumented, they aren't often able to take advantage of these protections. I think the fear of law enforcement is very real, even if they do have a legal claim or legal right to be protected from assault, abuse. Our patients are often fearful of making a report because they're afraid that that report may be linked to something else, especially their immigration status, and they may get reported, even though many localities have bars from cross-reporting. I think our patients are fearful that that may not always hold. There's always employment limitations. I think you saw in Todd's case, Shamsher's case, in this case. Patients who are undocumented often feel like they don't have any leverage to negotiate. They feel very lucky to have a job, and they're often asked to work in very unsafe conditions. And that often results in financial instability. They don't have access to benefits. They're often not paid well or even pays withheld, and they don't feel like they have much of a legal recourse. And obviously all of this leads to poor access to care, both because of fear, but also because they don't have insurance. They often don't have the luxury of being able to take time off, make a regularly scheduled doctor's appointment, and this is why we see them in the emergency department. And this all leads to poor health outcomes. So I think this really points to the fact that we may be the only people who see, as emergency physicians, see these individuals and have a chance to pick up on being able to make a difference for them, because they often do not present unless something really bad has happened to them. And so what's available? So there's a few different pathways in terms of immigration relief that's available from a legal standpoint. You might look at all these pathways and say, this doesn't seem to make a lot of sense. And you're absolutely correct, it doesn't. It's, our immigration system, especially in terms of immigration relief, is a patchwork of laws that came together. Some senator or some member of the House of Representatives or their staff probably read a story in the New York Times or the LA Times about an individual, such as one of the individuals we heard about, thought this is super messed up, they should get some help, and therefore Congress crafted a law that protects a special class of individuals. But there's no sort of overall big rational picture or rational system of laws that allows people to actually get immigration relief. So I think from this first class, the U visa, the T visa, and the VAWA, you could think of this as someone who's been the victim of a crime. And that crime has to have happened in the United States. If they're a victim of a serious crime, whether that be an assault, if they're a victim of domestic violence, if they're a victim of trafficking, sex trafficking, labor trafficking, some sort of serious crime, they can apply for immigration relief as long as they're willing to make a police report and cooperate with the prosecution of those who are the perpetrators of this crime. And it doesn't matter how they entered the country generally. If they entered in a way that was not through a visa or other deemed legal form of entry. This is one of the few ways where that doesn't matter. And sort of as you heard in Breena's case, a lot of these applications are pretty complex. There are a lot of time limits. If you fill something out, you may not get a second chance. So it's important that we identify this and sort of get people to the right individual to help them out. And then there's sort of a couple other ones, which is more for crimes perpetrated generally outside of the U.S., but can also include crimes perpetrated in the United States, usually asylees and minors. These individuals can also get immigration relief. And like I said, all of this doesn't make a lot of sense because these are sort of, once again, special laws that were put in place for certain subpopulations. And I think there are a couple other programs that were mentioned earlier: temporary protected status, DACA, the policy related to Cubans who make it to the U.S. All of these programs are often still in existence, but none of them are taking new applicants. So there's no longer immigration relief provided if individuals have not previously been granted these statuses. And I think many people might ask, how about family-based petitions or family-based applications, especially because many families are of mixed status, with some family members that are documented and others who are undocumented. I think the main thing to keep in mind here is some of our patients have no documented family members. And even if they do have documented family members, immigration laws are pretty tricky. If you entered illegally, often you have to leave, even if you're eligible for a green card or to apply for a green card, you often have to leave the country for an extended period of time, sometimes 5 to 10 years, before you're allowed back in, even if you can apply for a green card. So all of this is pretty tricky. So this brings us to something Todd's talking about later today, medical legal partnerships. What are those? Basically, lawyers in the healthcare setting. And lawyers who generally don't charge. They help people who are low income and vulnerable. They help with a number of things, including immigration, but also public benefits, family law, housing, etc. And most of these in this country are in primary care clinics, pediatric clinics, and a few in emergency departments. There's one in Highland. Todd's going to talk about one at LAC, USC later. But even if you don't have a medical legal partnership where the hospital or the healthcare setting has partnered with lawyers to have them in the healthcare setting, pretty much every place has a legal services or a legal aid organization. These are organizations that help individuals who are lower income. They don't charge any fees. They often have partners. Some have immigration restrictions, some don't, but there's usually help available. And they're usually the right people to help with what we just talked about earlier: U visas, T visas, VAWA, CIGIS, and asylee or refugee status. And once someone's granted status, they're pretty much immediately eligible for benefits. They're eligible for Medicaid. They're often eligible for food stamps or SNAP, and also for cash aid. So getting someone's status, identifying that in an emergency department, initiating that referral can really make a big difference for your patients who are eligible. And I think one thing to keep in mind is often a lot of our patients will say, oh, I'm working with someone, I just paid him $2,000. I have another $2,000 payment coming up. He's helping me with my immigration case. And often they're called notarios, who are individuals who aren't actually lawyers. They try to help with immigration cases. But as we talked about earlier, the cases are pretty complex. And these individuals often take a lot of money from individuals when help is available for free. And they also screw things up. And often you only get one bite of the apple. So it's really important, even if someone says they're getting help, to make sure they're not paying a ton of money. They actually have a good resource. And you can always say, oh, you might want to talk to these other individuals who might be able to help you out, especially if they're eligible for one of those other statuses. Because otherwise, if something gets screwed up, unfortunately, USCIS is pretty unforgiving. I'll turn it back over to